So last but not least, let's talk about the expectorants. The expectorants are used, they're drugs that are used in the aid of expectoration or removal of mucus. The goal here is to reduce the viscosity of the secretions or disintegrate and thin the secretions. They're often used in combination with the antitussives to provide relief for a dry, non-productive cough and to loosen the tenacious mucus or the congestion in the respiratory tract. So they stimulate the flow of mucus. There are two mechanisms of action that can be direct stimulation or reflex stimulation, with both of them having the final result of thinner mucus that's easier to remove. Now, when we see the most common we're going to see is our reflex stimulation, and that is our guaifenesin or our Mucinex, right? So reflex stimulation, the drug causes irritation to the GI tract, but it's loosening and thinning those respiratory secretions, and they occur in response to this irritation. It is an expectorant that we use maybe for things like sinusitis, pharyngitis. It is found in many over-the-counter medications and can also be in prescription preparations. But enhancing the expectoration by thinning these secretions helps to promote drainage. And so we also need to make sure that the very important thing that occurs with the use of expectorants is fluid. We can't thin the secretions if there's not enough fluid. So water, fluid intake is really important for these patients. With our direct stimulation, the secretory glands are stimulated directly to increase their production of respiratory tract fluids. An example of this medication is the iodine-containing products like iodinated glycerol or potassium iodide. But these are really less commonly used. In fact, as a nurse and a nurse practitioner, I would say that I have not seen these used in a long, long time. So the goal ultimately being that we loosen and thin these sputum, these secretions, and the tendency to cough is indirectly diminished. But also, what happens is we have the added benefit of this expectorant increasing the efficacy of the mucociliary mechanisms. So they remove the accumulated secretions from both the upper and the lower airways. So the irritation is less to the airways. We will see them used, like I said, for common cold, bronchitis, laryngitis, pharyngitis, coughs caused by chronic paranasal sinusitis. We'll also see them used in pertussis, sometimes influenza and measles. Now, one of the interesting things when we look at guaifenesin is that you will see it used sometimes in the treatment of fibromyalgia and chronic pain. And this occurred back in the 1990s when they were looking for ways to treat fibromyalgia. There was a provider that indicated that larger doses of guaifenesin, Mucinex at the time, would be effective because of the way that its mechanism of action is, in that it is mildly uricosuric. So what happened is a lot of research was put forth. People started taking, because it's over the counter, doses. They would start small and titrate up to these really large doses of Mucinex or guaifenesin and be taking them over the course of 24 hours, exceeding the recommended dose. That's one of the ways that we found that that guaifenesin is actually the safety of it is really high. It can be used safely, and so unfortunately, the It is slightly uricosuric, which means that it does remove some of the uric acid, but it doesn't do enough of that to be effective in the treatment of gout or in the treatment of fibromyalgia. So you will maybe have older patients who swear by it, who have taken large doses of guaifenesin for a long time, and they feel that that is important in treating their fibromyalgia. However, the research does not support its use in the use of chronic pain for fibromyalgia. So just something to be aware of with your patients, because we want to make sure that we get a complete medication history. And this is something that they could be getting and taking over the counter, but not for the indications that we have here on the chart, on the slide here. So what are some of our common side effects? With the guaifenesin, we will see nausea, vomiting, and gastric irritation. With the iodinated glycerol, we'll see GI irritation, rash, and sometimes an enlarged thyroid gland. And with the potassium iodide, it's iodism, nausea, vomiting, and taste perversion. So you can see why our iodinated glycerol and the potassium iodide are very rarely used. And like I said, I haven't seen them used in, I cannot remember when, many, many, many years. What are nursing implications for the expectorants? Well, we want to be sure that we use them with caution in the elderly. We want to use them with caution in anyone who has asthma or respiratory insufficiency. The expectorant is not for use in persistent coughs, especially those that occur with smoking or emphysema. We don't want to use them in coughs that have excessive secretions from things like COPD. Guaifenesin is actually rapidly absorbed in the GI tract, and it's rapidly metabolized and secreted in the urine. So the plasma half-life is about an hour. In our pediatric patients, it is recommended that we use it very cautiously in children up to 12 years of age, particularly if they have persistent cough or asthma. It is important to note that often asthma will present as a cough at night in children, and so sometimes patients will be treated with medication for a cough when it is truly turns out to be asthma. So a medical evaluation should be conducted before we treat children with expectorants, with the guaifenesin. They make a little sprinkle, a little Mucinex sprinkle type that a lot of times people like to use. So we want to be sure that they get a medical evaluation, especially if that cough continues. Overdose is pretty likely to occur with guaifenesin, but we want to be sure that our patients taking the expectorants get more fluids, and that helps to loosen and liquefy the secretions. If for some reason they can't have more fluids, there's some contraindication, then we may not use the expectorant. Another thing that we can add is humidity to the air, which will help. Have your patient report any fever, cough, or other symptoms that last longer than a week. And as always, we're going to monitor for the intended therapeutic effect, reminding them that a persistent cough can be a sign of a very serious condition and something that can go unnoticed. So that's all for today. If we have questions, be sure and give me an email, a call, a text. You know how to get a hold of me. You can post in the discussion forum. Look forward to seeing you soon, and take care.